and thank you for joining another exciting virtual live stream, our virtual town halls, that is, live stream with a very special guest that we have tonight. This is, I'm sure everyone's seeing the invite. Without further ado, I'd like to just introduce the Commissioner of the Nassau County Police Department. We are all very honored and grateful that Commissioner Ryder has joined us tonight, has taken time out of a very, very busy schedule that he has to join us tonight and share with us his insights and his experiences with regards to the coronavirus. I'm sure there may be other questions that are not corona related, but I anticipate those to be the focus of the questions that we see tonight. Please feel free to type in your questions down below in the comment box, as always. And on Facebook, same thing on a Facebook live stream. You have a comment window where you can submit your comments and feedback. Without further ado, I'd like to introduce, the Commissioner asked me not to introduce him. So on top of everything else, of him doing so much for us, he's also very humble and modest, which is hard to come by these days. But I would like to say a few words about him, and why don't we just bring him on while I do that. Well, he'll be with us in a second. Commissioner Ryder, you should have an invite. There you are.
Hey.
You're a master.
How are you?
Technology. How are you, Commissioner?
I'm good. I'm catching up with this new technology stuff.
There you go. There you go. You know, there's this thing called telex. If you want, we can send you a telex. We'll telex you the questions if you'd like.
Don't get it complicated. Just ask now. It'll be easier.
All right. I was starting to say that you asked me not to introduce you, but despite that, I think that we need to introduce someone of your stature and of your selflessness with everything that you do for the community and have done for many years. So just bear with me while you blush and I do this intro. It'll take a second, but I do want everyone to be aware that, first of all, you are, like I said, very modest and humble. You didn't want me to do this, but I'm going to do it anyway. So Commissioner Ryder has been a police officer, a cop, as he says it, for 37 years. He's been a commissioner for the last 3 years, commissioner of Nassau County Police Department. And he's been the following. He's been a cop in the undercover narcotics unit. He's been a SWAT team guy. He's worked in the asset forfeitures rather, and he's built the intelligence unit of the Nassau County Police Department. He has a master's degree in Homeland Security Management, and he's also certified anti-laundering money specialist. And I think we just lost half of our viewership probably by me saying that. Everyone's going to get scared and run away. He's also married with 3 kids who just turned 21. Congratulations. Are they really triplets?
Triplets in confinement.
Oh my goodness. Triplets on confinement.
You can't go out.
And there's a police officer to ensure their confinement, right?
That's my wife.
Without further ado, thank you very much, Commissioner Ryder, for joining us tonight, and welcome.
Thank you. Thank you for having me.
Thank you. I'm sure I speak on behalf of the entire community for tipping our hats to you and thanking you for everything that you do, you've done, and you will do, and for your time tonight. So why don't you go ahead and give us a little intro of where you are, where you stand, whatever you have on your heart, and then we can jump into questions.
Sure. So first of all, I want to apologize for I'm not shaving. It's my first 2 days off in the last 44 days. So I decided I'm not going to shave for a couple of days. So
and I had you covered. You see?
I see that. I see that. So I know I'm in good company. So it's been a hectic since March 13th. The world has been a little bit upside down here in Nassau County. You know, and when you look at what we've gone through so far, what we're going through and about our recovery process, I'll go through some things with you so you have a little history and you also understand what goes on every day in Nassau County. So on March 13th, the county exec declared a state of emergency. Shortly thereafter, on the 20th, the governor said, we're going to start quarantine. Unless you're an essential worker, you got to stay home. That puts business into struggles. The schools went back, and now they're out till May 15th right now. There's discussions about getting the economy back and all of those items that are important to all of us that are out there. Besides the fact, the most important thing is that we have loved ones that are dying in homes and in hospitals and nursing homes that people can't even go say goodbye to because of how contagious this disease is. If you look at the normal flu, they say it's in a 1-to-4 ratio. One person that gets the flu spreads it to 4 others. In this one, they're looking at a 1-to-10 ratio, and it spreads quickly. And that was the big problem right here in the beginning when it hit, and it hit hard and took off as fast as it did. So I give you some of the numbers so you have an idea of where we are. But if I took you back to March 1st, we only had a few deaths and a few cases. But right now, we're at 34,552 numbers here in Nassau. So people need to understand what that means. It's 34,552 people that live here in Nassau County that tested positive, not somebody that came into our county and got tested. That is up 733 new cases today alone.
Oh my goodness!
But about 2 weeks ago, 3 weeks ago, we were averaging about 1,200 new cases a day. So when you think about how it's starting to decline, and we look at the numbers, when you look at the deaths here in Nassau County, there are 1,558 people that have lost their life to the COVID virus. Again, those are residents. When the governor gives his number is higher. And that's because anybody that dies in the county is recorded under the governor. Anybody that is a resident of the county is recorded under us.
Got it.
That's 29 deaths in the last 24 hours. That's small compared to, again, where it was a week ago when we were losing 80 to 100 people in a 24-hour cycle. And I say that so people understand it's trending in the right direction. You hear them talking about that. They talk about the positive numbers. They talk about the deaths. Your positive numbers only climb. They're not going to go backwards because everybody that gets tested, you get a new positive, it goes up by 1. So we test more people here in Nassau County than just about anywhere else in the country. So there's a lot of testing that's going on here in the county, so that number will grow.
Why is that, Commissioner? Why is it that we test more?
Well, we're very educated and a very affluent community here in Nassau. So we take advantage. We have great medical here in Nassau County. The 11 hospitals that are here in the county have been working side by side with us to make sure everybody's in the same step. So people have the ability to go get tested. We just opened up 2 testing sites, one in Hempstead, one in Freeport. We're opening up one this week in Elmont, and then an additional one in Westbury. The purpose of that is to reach the poorer communities so we can get more of those tested in those communities that have seen a high volume of the death and positive numbers. So we're going into the communities firsthand. So when you have to look to see when they talk about that flattening of the curve, how it's going to, or the decline to get us back to the normalcy. There will never be the same normal as it was before. But that's okay. It's acceptable that when you go into Home Depot, the shop, you wear a mask now. It may be acceptable that occupancy in restaurants shrink a little bit, so not to fit as many tables in. It may be normal that they go back, and you've seen in some other states that are starting to open up, talk about servers will wear masks. So again, I think the outcome of this will be a much healthier community, because we're all going to be aware that if you're going to sneeze, you sneeze into the elbow. If you're sick, you stay home. How many times have people come into work and they say, I'm going to work through this, I'm going to work through this. This is not the time to work through it. If you are sick, and you've heard the county exec say it 1,000 times, and the governor's office and the president, stay home. Just stay home if you're not feeling well. But in the police department, there's 3,600 members between the sworn and civilian side of things. We have 181 officers that have tested positive for the COVID virus.
Wow.
But that's a 5% number. It's terrible in the fact that we have one, but if we were able to control it early on because we got the protective gear to the officers. We cleaned the cars, we cleaned the station houses, we cleaned the police booths. They wear gloves, masks, gowns, face shields, goggles. Our police medics, who have done an outstanding job in this county, go into those locations, and many times they'll tell the officer, you wait here, I'll handle it. If I can walk them to the bus, we will, and then you could drive the ambulance in. So it lessens the exposure, and our police medics are more on the professional side of knowing how to handle exposure situations because they live in it every day, not just during COVID, but during any kind of flu season. So they're trained to do that. So working together as a team between law enforcement, police medics, your volunteer fire services have all come together to give you a better outcome than what it could have been. And if you look at,
it's amazing.
you look at the numbers just to the west of us, I think the NYPD had 18 or 19% of their members affected at one point.
Wow.
So we've also gotten back to work 371 members. They were out because they self-quarantined. In the exposure, way in the beginning, if someone got sick or was exposed and tested positive, the person that worked with him, we'd tell him, hey, stay home, self-quarantine for 14 days. And then they would come back. So we had a lot of workers out for a while. But like I said, we've come back and 371 workers are back. And right now I have only 71 members that are out positive right now, are in that self-quarantine mode. Part of what happens when the county exec called for a state of emergency, it activates the Office of Emergency Management. It puts in place an incident commander system. I am the incident commander for the county, as designated by the laws of the county. So I take over all the first responders, emergency response here in Nassau County, volunteer fire service, the workings with in cooperation with the DPW, Office of Emergency Management, Department of Health. When I say I overtake, they still run as individual silos, but we coordinate at the Office of Emergency Management. Every day, every township is represented, every agency in the county is represented. Department of Health is there, and who's done an outstanding job. Dr. Eisenstein and his whole team have done a great job on getting the information out. We have all our volunteer fire services, our police medics. We had a problem in the beginning because of the rush, the amount of bodies that were coming into the hospitals and the transportation of them. Under the FEMA, we were able to request ambulances. So you might have seen them driving around the county. AMR is on the side. American Medical Responders, I believe is what it's called. They came in with 15 ambulances, two staffed emergency response officers, ambulance medics in them. They went out and they responded to these calls. They were a great assist. Of volunteer fire departments, which are volunteers, came in and they staffed 55 ambulances a day on the average. So they were all doing their part, working together to relieve some of the stress. But when you look at numbers, and again, I'll give you another number, the one that a lot of people don't understand is the morgue. People did die in this epidemic, as we all know.
Right.
What happens when cemeteries get backed up, or cremations get backed up? We have a problem that the bodies have to stay somewhere. When you die in a hospital, normally you go to the morgue in the hospital. And from that location, you then wait for your direct burial through the funeral director that will pick the body up. When you die at home, if you're in a hospice care, many times the funeral director will pick you up. Because of COVID, many of these situations all got backed up. Cemeteries got backed up, funeral directors got backed up, hospitals got backed up. So in normal capacity, we have 578 available spaces for bodies in the county between the 11 hospitals. We were close to 300 people in those morgues, on top of what was backed up at the ME's office, the medical examiner.
Oh, wow.
So we worked out a coordination effort. We worked with the funeral directors, who've done an outstanding job during this crisis. We worked with the hospitals and their morgue personnel, and we worked with the ME's office, who's worked above and beyond in this crisis. And we ordered in what's called refrigeration systems, same as that they would store a body that's both respectful and remembers that, this is someone that just lost their life. So they're very respectful about it, but they take and store those bodies until the cemeteries are ready to move them. That's a complicated process. There's a lot to it. The townships had to come in and rush up getting us the death certificates that we need. Again, funeral directors working together. So we worked through all of that by ordering extra refrigeration trucks and stuff. Here's the positive numbers you look at, and I'll give them to you. These are what goes through every day. In the morning, I get a briefing. Then that briefing goes to the county executive. County exec does her briefing. Then by the end of the day, we do a second briefing to get the 24-hour cycle. And to give you an idea, this is this afternoon's briefing. So yesterday, there were 415 patients in our 11 hospitals that were on ventilators. 70% on average don't make it off a ventilator. So that's,
wow.
Yeah. So it's at critical state. 352, that's 26 less than the other day, are now on ventilators. So either they came off that ventilator or they did not make it. But that shrinking number is an improvement from where we were up to 550. Now we're down to 350. Those that are in ICU, that are critical patients for COVID, that number's down to 431. That number was about 550. We're down to 431. That's 20 less than yesterday. Those that are in hospitals right now that are positive for COVID, not in ICU, not on a ventilator, the total number is 1,499. We were averaging about 2,600 bodies that were in the hospitals, patients in the hospitals being treated for COVID. As you saw, most of the hospitals had to stop their surgeries that were elective. They only had to do emergency surgeries,
right,
set up only for COVID patients. Again, we speak to them on a daily basis through the Department of Health and get those numbers in. So, and then yesterday alone, we discharged another 176 people out of hospitals. That's all good trending numbers. That's what we like to talk about. And when I spoke to my police force tonight in an email that I sent out to the group, and I told them, look, the numbers are trending good, but let's not get complacent. Let's remember what we're trying to do here. Yesterday, there was 141 police medics responded to 141 calls between police and fire. 52 of them were pandemic calls. That number was averaging about 80 to 90 only a week ago. And we're doing a 250 to 300 calls a day. So that's coming down. That's also showing an improvement to where we were. So we can't get complacent. We got to remember to wear the mask, wash our hands and everything else. And we also have to remember that the gatherings. So we get a lot of problems with our gatherings. We've had 1,600 complaints since March 13th about gatherings. Actually, since the 20th when the governor quarantined everybody.
When you say complaint, that's actual citizens calling and saying that we see a gathering.
Yep. They'll call up and they'll say, hey, we got a problem. There's a gathering here. There's a function going on. We would respond with the fire marshal if it's inside, with the police if it's outside. We would get them to break up. We've only had to issue 18 tickets. That's a real good number because most people realize what they've done. They become compliant and they break up the group and they move on. So
it's a good Jewish number. It's called Chai. It's to life. Just keep it at 18. Don't issue anymore.
I'm hoping so. I'm hoping we all work together. But again, those are the numbers that are looking. Here's one thing that's changed in this whole COVID thing. We had a crime number back on March 1st. Our major crime in the county was up 18%. We've had 12 years of record low crimes, keep declining in the right direction. Major crime went up 18% because we had justice reform, little change in the way we do business. And that's now being evaluated and going back in some changes. But since then, since March 13th, we are now dropped almost 15 points in crime.
Wow.
So bad guys are staying in. Our quality of life crimes, our smaller crimes, have gone down 10 to 12%. We're 10 to 12% under in crime in that area and just slightly above in major crime. Bad guys are staying in also. They're not coming out. We're home. Burglaries have stopped. We witness people doing crimes. Everybody's more astute and out and about in their neighborhoods. So again, that's reduced our crime, which has been very helpful too.
That's very interesting. Actually, it's counterintuitive. I had that question for you for tonight. Actually, I would expect crime to increase because now one would imagine the force is busy and distracted, if you will, with this important big event, pandemic event. That would open up the doors to, and you don't hear it even worldwide. I think that organized crime or terrorism, things like that, don't seem to be taking advantage of the situation.
No, there has been one ISIS as Passover ended, Ramadan beginning. There was an ISIS threat that said we should act out now, and this is trying to stimulate those lone wolves that are at home, trying to get them engaged. Thank God nothing has happened. We had a peaceful Passover. Easter was very peaceful, and now Ramadan is about almost midway, I believe. So again, so far so good. Let's hope everything stays that way. But our intelligence bureau is on top of everything. They speak daily to NYPD and our FBI and federal partners. We get updated briefings, and then they'll update me on it daily to let me know if there's any changes.
Wonderful, wonderful. Thank you for that brief, and I think we will open up to the community to ask any questions that they have. We already saw a few questions that scrolled through. I would encourage the membership here, the participants here, to just type in live in the request or the comment box, indicating that you want to go live, and hopefully you'll have the courage to grab the microphone and the camera and go live and present your question to the commissioner directly instead of just typing it up. But until we see that, let's just take maybe one or two questions that we've saw scrolling above. First of all, we had actually a friend of mine, Jonathan Levian. Maybe you know the name Levian. It's a popular name here in Great Neck. He's saying what I think the notion that we all have is thank you for everything that you do, Commissioner.
Wow.
And I think he's speaking to you both personally and to the entire force. We have a question, Jay Hakimian, Commissioner. When do you estimate the non-essential businesses in the county will start to reopen? Do you have any thoughts or metrics on that?
So a lot of it comes from the governor's level. That's where that call will come from. Our county exec wants to get the businesses back. You've heard us say it. I think you're going to see some slight changes come May 1st, some re-engages, but I believe the governor's looking at May 15th to start really opening things up and getting it back. You know, everybody wants it back. The governor wants it back. The county exec wants it back. We all want it back. But, you know, if you jump out too early and you see what's going on in China right now, you'll get that second wave, and that second wave could put us right back to where we were. I think we're a smarter, educated residents now and community here. I think we understand this virus a lot better. We're waiting for the antibody test to come out. We hope that the governor's going to have something this week, and then he's going to open that door that we'll get all the essential and first responders and everybody tested right away for the antibody. Not that it's going to say guarantee that you're not going to get it again, but it'll give people some comfort level to know many people have had this virus and didn't know they had it. You know, they had a little bit of a cold or something. I've had some of my own police officers say, I didn't feel anything. I had the exposure. I felt a little cough. I got tested. They said I was positive, and it left right after that. And, you know, they were back to work in a couple of days. So it all depends how it treats everybody differently. So I think
there's such a diverse reaction amongst the population.
Yeah, I think we're close. Within the week to 2 weeks, we're going to see a lot of things. And I think they're going to start announcing their plans. I hope so. And it'll be a slow, progressive move back. But by the summer, we should be all booming again and the economy taking off.
Yeah, Commissioner, I would just correct what you said. I don't think everyone wants this to be over and for everyone to get out. I think it's everyone except the CEO of Zoom and the shareholders of Zoom.
Yeah.
Aside from them, everyone. Yeah, but them, I think they're very happy with
yes. We use Teams at work all the time, and I got multiple people looking at a screen at me. So.
That's true. I had, again, if anyone has any questions, please either request, you have a button on the bottom of your screen, tap request to go live, and hopefully you can take the mic and camera and ask your question directly to the commissioner, or any comments or suggestions or any kind of feedback that you have, that's all welcome. I would also say that, type the word live in the comment box. That's another way that you can go live with us. And if you have any questions and you're shy about going live with the camera, that's fine as well. Just type that up in the comment box. Commissioner, I had a more personal question for you. I know everyone's thinking about COVID and when we're getting back and how's the death counts and are we on the downslope now. I'm fascinated more on a personal level with have you ever? I'm sure I'll answer the question. The first part of the question: have you ever imagined that you would ever encounter something like this in your career, in your wildest dreams? I'm sure you didn't prepare for this. You didn't imagine it would happen. I'm just curious how that's been for you personally, managing, I've managed some large projects in IT, but it obviously nothing compares to what you're undertaking and the department that you run and the tremendous amount of pressure I'm sure that you're subjected to. Yeah. So I'd like to hear a little bit about that if you don't mind sharing that.
Sure. So I've been there for the blackout. In New York City, I was there back in 1985, I believe it was the blackout. And then again, when we had the blackout here on the whole East Coast, I was a sergeant when I worked during Sandy. I was responsible for the South Shore security detail. I also worked at Ground Zero. I was down there with many of my friends that lost their life. This by far is the most stressful period. I come home every day. I'm home earlier than I'm normally home. My normal days start at 6 and I get home by 10. Now I'm walking back in the door by 6 o'clock at night, and it's because the briefings and everything is done, but you're stressed, you're burnt, and it's an emotional drive to talk about body bags and refrigeration
Wow.
and bodies and that's from my side, holding that responsibility as a commissioner, holding that responsibility as the incident commander. But I can only imagine what it is for my police medics, my police officers, my fire services, my Office of Emergency Management under Commissioner Morelli have done a great job. My Homeland guys under Inspector Leahy and Rob Conley. These guys are out there day in and day out, and we're making sure that when a hospital calls up and says, we don't have gowns, that's our job to get the gowns. When we don't have PPEs like masks, it's our job to get that. We got to get in touch with the state. We've gone out and done our own shopping, sent cops out and said, go find these items. We're running out of them. We need to get them. And we find them in the store. We put it on the credit card and buy it in and get our guys reimbursed for what they spent. That's sometimes that's stressful. But it's not as stressful as those. I lost a good friend, Jimmy Adelis. He was one of my honorary commissioners here. He lost the battle right in the first week and a half. Jimmy had underlying health conditions, but it just got him and got him good. But, you know, it's tougher on that family than it is on me, and that's what I look at. I'm trying to ease the pain for other people. My cops do that day in and day out. We're looking out for those people that can't help themselves, that don't have a voice. That's what we try to do. And our cops have done, and all of our first responders, and I always got to stop that. It's all of our first responders have done an outstanding job. Those nurses and doctors that go in, and we know them all, right? We're very friendly with our hospital world as police officers. And, you know, they've done an outstanding job to make sure that people are treated with the respect, FaceTiming patients when they can't get up to see their loved ones. And so we're all trying to do what's right here and working together.
God bless you all for everything you do. It's so humbling to see, you know, so much goodness coming out from so many people above and beyond the call of duty, right? I mean, I'm sure none of your officers signed up for, you know, walking into a house with a COVID patient and helping out a situation there.
Yeah, it's
so
tough.
bless you all. How many losses have you had in the force?
I don't know. I'm happy to say none in the Nassau County Police Department. There's been some deaths in our volunteer fire services, and of course New York City has lost a few. So, but we have families and friends that have all had loved ones pass. So,
sure. Oh, that's good. Good to hear that it's been minimal. We have one question here from a member of the community about about possible rumors, white supremacists trying to spread the virus among Jewish and other minorities, Black communities. Is there found that any kind of basis for that, or is that all just rumors?
That gets on the rumor mill, right? That pops around. White supremacists. They got a little bit of an active role here in Nassau County. We have them also here on the island. We have a bunch of anarchist groups. We have a thing called the New York Mag. We have a group called the Oath Keepers. We're always going to have prejudice. We're always going to have those that are, but we have a zero tolerance for here in Nassau County in the police department, and we act out right away. We have a very strong intel community, a counterterrorism group that handles all these groups, works out of our intel center with NYPD, MTA, and federal partners, that we make sure that we're looking at this stuff and stomp it right away before it tries to get out of control.
Right. Yeah, we should have invited a few of them for tonight's live stream. It would have been more interesting.
Okay. No, please don't invite them.
I'm glad we have a sense of humor about that and about the whole situation.
Yeah. You know,
what have you seen? Sorry, go ahead.
Cops have that sense of humor, right? We always try to, when it's the hardest times, we laugh. Sometimes when it's death, we laugh because it's getting that stress out. Some people handle it differently. We have a high rate of suicide in law enforcement to begin with, and so times like this makes me concerned. I've reached out to my membership. I constantly speak to them and let them know, hey, we have resources to help you. You need a day off, take it. If you're not feeling good, stay home. On top of keeping the 1.4 million people here in Nassau County safe, I got to also take care of my members, because if they're not in good shape, they're not going to be there to take care of everybody else. So we've done an excellent job. Our management team done a great job taking care of all our first responders.
All right. What can the community do to thank you, because I mean, my wife and I, we always try to teach our kids. You know, we have three daughters, and we always try to teach. You know, you have to have great. You have to be grateful. You see an officer, you thank them for the service. You see a soldier. Sometimes we visit Israel and whatnot. We thank the soldiers, and many times I get. You know, I've had let's say on 9/11 in the city, there have been fire department either ceremonies or just running into a firefighter, and you just say thank you, and you're taken aback. You're not used to people thanking you, it seems like.
So there was a little pushback against law enforcement, and there always is. You know, you have the anti-law enforcement. We're the establishment, according to people that have act out against somebody. So they were spitting on police officers, throwing water on police officers. You do that, you do that in Nassau County, you're going to get locked up, first of all. But what you can do for all of us, you know, listen, the pouring of support from our community is, they're like the 13th man in football, right? The fans, they've come to our station houses, they've made masks, they've donated stuff. We had Easter candy dropped off. We had ice cream dropped off, food, pizzas, heroes, you know, people making cards and envelopes and dropping stuff off and just saying, thank you, thank you. That's all a cop wants. A cop just wants you to say, thank you, officer. Thank you for what you do. Same thing with your fire department. Don't forget, they're volunteers, and they do a great job. Our police medics, they're the front line of the front line in this pandemic. And, you know, they just want to hear somebody say thank you. Our communications bureau. I'll tell you who one of the biggest and gets the least recognition in this whole thing is the Department of Public Works. The Nassau County Department of Public Works, electricians are cleaning buildings now. Carpenters are cleaning buildings. They're cleaning booths. They're finding ways to keep the ambulance clean and the police cars clean. Wow. They have to sterilize environments constantly to kill the virus. Unsung heroes. They really, and you know, they got families and problems at home too. And they're coming in, and when you're cleaning the surface that's infected, the opportunity, the possibility of you getting it is even higher. So they've done a great job. Civilians in this world have done an outstanding job for us. So we say thank you to everybody out there. The only problem I'm going to have is my cop's cholesterol is going to go way up because of the ice cream, but it was enjoyable.
What ice cream? But at least we're not having donuts, right? So ice cream and donuts trip down
switch it around. Everybody's got a donut joke.
I had to throw in a donut joke. Otherwise, they would not believe that you're actually the police commissioner, right? They would think it's a fake. So, I mean, that's fantastic. It's so humbling to hear that, and all the volunteer work that happens. Is all of Nassau County Fire Department is always volunteer? There is no, like New York City? There's
a few in the cities. I think at one time Garden City had, Long Beach does. There's a few paid dispatchers in the world out there, and they get paid by the members within. But I got to tell you, you know, we always struggle. They work. They got 9 to 5 jobs. You know, we're calling them out at 3 o'clock in the morning. You know, when it's the fire, well, they're all in. You know, that's what they signed up for. When it's the ambulance call, it's like, you know, I got to go to work in the morning. And we get it. And we have paid medics that do that. They're always stand up, the volunteers. They've exceptionally been stand up during this time. Really stepped outside the box and did the right thing. And so have many of the other, like I said, Department of Social Service. People got to get fed. There's homeless people out there. They've done a great job. Department of Health, an outstanding job. I can't tell you how successful our support has been from the Nassau County Medical Center. That's where my cops go to get tested. And they do an outstanding job, and all of them have been treated as like professionals as they should be, but those are the professionals that are taking care of my professionals. So I appreciate that too.
Thank you, Commissioner. So what does the Ryder household do for fun during lockdown?
We do a lot of eating. A lot of eating. Yeah. You know, my daughter and my wife are watching American Idol right now. As you know, Liam is here helping me because I'm not the most technical.
Poor guy. He's not having fun. He's not watching anything. He's stuck here with us, and they're having fun with America. I say we call him up, and they have to watch you. That'll be like punishment.
Well, and my other guy Sean is downstairs lifting in the basement, so he just came up. So
okay, good.
And the dog's laying in the back, so we got it all covered.
That's the difference between, you know, the commissioner's household and a nice Jewish household like myself. Our definition of exercise is throwing darts in the basement. That's the extent of my exertion.
Yeah.
So, is there any other question for the commissioner before we let him go? I know he's very, very busy, and we thank him very much for taking time out of his busy schedule. If anyone has any other comments, questions, suggestions, by all means, type it in the comment box below or request to go live, and hopefully we could see you live and hear some feedback and comments. Otherwise, we will call it a night, and we will thank the commissioner. Maybe you'll have some closing thoughts by the commissioner himself, and then if there's any other questions, we can field those. Otherwise, we'll call it a night.
So I'd like to say thank you to the community. Thank you for the support you're giving my members out there. This is a disease, a virus that we've never seen this before in our lifetime. You know, most of the time I put my guys into a ring, they know what they're fighting. You could see it. This you can't see. You don't know where it's coming from. It is a virus. It's a deadly virus to those that have underlying conditions. Most people that are healthy survive, you know, within a couple of days, and they're back to feeling normal. Some people get hit harder than others. We're all, and you know, it's said so many times, but in this situation, it truly is. We are all in this together. Everybody has a role. So everybody has somebody that has been affected by it. And if we keep working together, when we use that common sense and don't put 100 people into a house right now for a party, just let's wait this thing through. A couple more weeks, you're going to see some changes coming. The governor's got the right focus. You know, when do you see the president, the governor, and the county exec all kind of saying the same message? We want to get people back to work, but we want to do it right. We want to keep everybody healthy. We love our communities. They love our police, and we're very thankful for all of them. So we say thank you to all of you, and please keep us in your prayers so that we, you know, that we stay healthy, and I make the right choices to keep them healthy.
Thank you very much, Commissioner. Thank you to you and the entire force, and for everything, all the selfless hours that you spend serving the community and everything you do for us. We have another feedback here. You could see it on your screen. Thank you for all the police force, everything that you do for the community. Absolutely. We're all very, very thankful and appreciative of everything that you do. Day in and day out, you're putting your lives on the line for us, and we really appreciate it.
Thank you.
Thank you again for your time, and thank you for agreeing to do this. I know you're not a tech savvy, but you're a natural. We're gonna do this like every other night.
I'm usually in bed by now, and I got to shave for tomorrow morning, so we'll see.
You have a waiver. Whoever gives you a hard time, tell them to call me. I know the commissioner. I'll put in a good word.
There you go. I'll come back anytime. Thank you.
Thank you so much. And I'll tell you, you know, personally, I'll just give you one piece of feedback myself personally. You know, it's such an honor and a pleasure to see someone that's human. You know, we think of the police commissioner. Oh my goodness, you know, you're a human. You're personable. You're fun. So that's really, for me personally, very reassuring that, you know, we have a force that's a fun force. It's a force that's accessible and engageable, and you know, we can reach out to you guys. You're all humans.
Yeah, they are, and we're all here for you. That's what's important.
Thank you very much, Commissioner.
Thank you.
Have a great night.
Thank you.
God bless. Stay safe.
Bye-bye.